Hi friends, so now we'll start up with the microbiology and how's the exam gone and how you find the microbiology questions, do tell us. Hi, good evening Sama, good evening Yash, Arif, Jianshu, Kumar, hello, how are you? So start karte hain. Let's start up. Let's see the first question. A professor during a viva asked the students about the mechanism of action by which the toxin of Pseudomonas acts. Okay, which of the following would have been his answer so that the professor was satisfied by the answer of the student. Professor never gets satisfied. First thing is that. So yes, yeah, Vikas, hi. Tell me, what is the answer of this question? What you have marked up? Shweta, hi. Arif, hi. Ramesh, hi. चलो अब बात करते हैं रोहन. Don't worry. Tell the answer of this question. And the first answer, Abhi have told C. The Saurav have told C. And Hadar have also told C. So everybody is going towards C. Yes or no? Is it the answer C? Dr. Payal have told C. Swati have told hello. Yes, please. More answers I want. Ashwin also told C. And the answer is C, no doubt. Okay. So basically, inhibition of elongation factor 2 is the mechanism by which the Pseudomonas exotoxin acts upon. Okay. Exotoxin acts upon, and I already told up in the videos also. Remember this mnemonic, DSP. So what is DSP? Dr. Sonu Panwar. Okay. So this particular one basically acts by inhibition of elongation factor 2. And what is that in DSP? D is diphtheria. Okay. Diphtheria toxin. S is Shigella. And P is Pseudomonas. Okay. P is Pseudomonas. And let me tell you very frankly that the Pseudomonas, this particular one, is a gram-negative bacteria. Gram-negative bacteria mostly secretes what? They secretes up endotoxin. But these actions are of exotoxin. Remember this. Shigella also is one of the gram-negative bacteria which secrete exo as well as endotoxin. And diphtheria, this particular one is a gram-positive one. And gram-positive one, obviously, what they secrete? They secrete exotoxins. Okay. So this is very much done. That inhibition of elongation factor 2 is being done by these three important ones. One is diphtheria, one is Shigella, and one is Pseudomonas. And in them also, their exotoxin acts through this mechanism. Endotoxin is having different stuff, but exotoxin is acting through this inhibition of elongation factor 2. Okay. So basically what happens in ADP ribosylation happens in this particular one, and thereby inhibition of protein synthesis happens. Okay. Hi Rahul. Now, telling about this, can you tell me that where there is an increase in the cyclic AMP, where there is an increase in the toxin action of the cyclic AMP? So cyclic AMP comes up at various places actually. Even the Vibrio cholerae is having the increase in the cyclic AMP. Okay. Along with that, if we talk about the Bacillus cereus diarrheal one. Okay. If we talk about the Bacillus cereus diarrheal one, this particular one is there. And the E. coli, in fact, which E. coli? That is a toxigenic E. coli. This one acts through increased cyclic AMP. Which one? The labile toxin of it. Okay. The labile toxin of this particular one also acts through the increase in the cyclic AMP. Even the anthrax toxin, Bacillus anthracis, as you are telling up, the Bacillus anthracis also, which is a question which can come, that which is a tripartite toxin. So Bacillus anthracis is a tripartite toxin. Vibrio cholerae, Bacillus cereus diarrheal one, E. coli, these all, in that E. coli also which one? Labile toxin. These all, they act through which mechanism? Increase in the cyclic AMP. Is it fine? So this is regarding the AMP which you need to know. Besides that, if somebody asks you, there is an increase in cyclic GMP. So at least two you should remember. And the 2-1 are which one? The 2-1 are, one of them is your Bacillus cereus. Bacillus cereus ematic strain, the Chinese fried rice one. Okay, reheated Chinese fried rice. Yes, you are also right, pertussis. So Bacillus cereus ematic one, this one. Along with that, E. coli heat stable toxin. So for both of them, the mechanism of action is increase in the cyclic GMP. And what is GMP? Guanosine monophosphate. Okay, guanosine monophosphate. Okay, so now talking about the D option. So D option is inhibition of 60S ribosomal subunit. Okay, inhibition of 60S ribosomal subunit. This particular one was asked in this FMG exam. Okay, and it can be definitely asked in the NEET PG for sure. So inhibition of 60S ribosomal unit is done by this particular one, that is the Shiga toxin. Okay, or you can say Shiga-like toxin. Fine. So Shiga toxin is secreted by Shigella, and along with that you have this EHEC O157H7. Okay, this also acts through inhibition of 60S ribosomal subunit. So answer to this particular question is C.